If you have a hand that is tingling, numb, or falls asleep on you, listen close. Hi everybody, this is Dr. Ryan House with Cumberland Chiropractic and Sports Medicine. We have done a few cases so far. We've treated a baby. We've talked about some examination tactics we use here at Cumberland. First of all, before I tell you about another cool case, I want to tell you why we're doing this. It's really simple. We feel that there's a fear factor that people may experience if they're struggling with something. Okay, simple as this. We want to kind of add some familiarity and reduce that fear factor. Maybe some more people will decide, you know what, that's not so worrisome. I'm going to get myself fixed. So, got a really cool case of a 40-something-year-old hygienist. So, if you can imagine, she sits around all day doing a posture that I would never encourage. Okay, after quite a few years, over 15, 20 years of doing that work, she comes to us after experiencing carpal tunnel syndrome. Been to quite a few doctors, talked about surgery quite a few times, tried quite a few avenues to get help, and she said, man, doc, I have got to get this hand tingling gone. Okay? So, like I said, carpal tunnel syndrome is the words that she used, so you know she's got knowledge. I asked her, are you sure that the entire hands tingle? And she said, oh yeah. And I said, pinky, thumb? She said, yeah, pinky, thumb. Front side, back side? She said, yes, front side, back side. I said, first of all, you don't have carpal tunnel syndrome. You could have a carpal tunnel problem, but you also have a problem somewhere else. Let me show you why. So if you have tingling, numbness, or your hand is falling asleep, I want you to listen closely here, because carpal tunnel syndrome only affects the first finger, the second finger, the third finger, and half of the fourth. How do I know that? Let me take the skin away and show you. So the carpal tunnel is a tunnel that's formed from this strap called your flexor retinaculum, some tendons and bones underneath like the floor, and muscles on each side like the walls. So this is our tunnel. That median nerve passes right through. That's a cool view, right? So, the median nerve only supplies this portion of the hand. Our patient had pinky symptoms, our patient had back of the hand symptoms, so I had to go looking elsewhere. She ended up having a problem where all the nerves are together in her underarm, armpit area called the axilla. You can probably see how complicated that looks, and that entire bundle was matted down to the muscles adjacent to it. If we did not find that she had both of those problems, we could never have fixed her. So, our nerve is stuck at two different spots. How do we get it better? Since the wrist is so exposed, I'm going to show you. We use a technique called active release technique. It works great for nerve problems. Hers was stuck right here like we talked about. If I hold that spot and then I have her and I make the nerve slide. If I hold that spot and have her make the nerve slide, we're going to do that sometimes. And if I'm really, really picky, after 3 or 4 visits, then she has no symptoms. She can sleep without waking up and shaking her hand out. She can work without the discomfort. She just doesn't have to worry about her problem anymore. If you're struggling with this, there's no reason to keep going. There's no reason to talk about surgery until you've seen us. If you like this video, click the thumb. If you know of somebody that needs to see this, put it on your news feed. Share it with them. If you've got a question or a comment, please leave it down below. Would love to answer those questions for you. I guarantee if you're thinking it, somebody else probably is too. Hopefully we've dispelled some of that fear factor. If you need us, call us. This has been Dr. Ryan House with Cumberland Chiropractic, where we get you better faster.